thank the Chair for the recognition. You know, if we're going to tell stories here, let's start out with once upon a time, and maybe we can end with, and they lived happily ever after. Whose budgetary plan puts Medicare at the most risk? Is it the responsible Republican plan that was debated on this floor for hours over a month ago? This was a plan, for the first time, we had laid out for us a roadmap, a pathway for how to save Medicare for people who are going to enter the program in 20 years, 30 years' time. Now, what is the plan on the other side? Well, there was no plan from House Democrats. There is no plan from the Senate Democrats. There is a plan from the President. The President laid out his aspirational budget just as the Republicans laid out their aspirational program, which was their budget. And the President's aspirational document laid out a very clear path. The President believes in 15 people, not elected by anyone, but appointed by him, and their ability to control cost in the Medicare system. It was written into a bill called the Patient Protection Affordable Care Act. You may remember it. Now, I have a great deal of sympathy with those on the other side who do not like the Independent Payment Advisory Board. In fact, one of their number wrote an editorial for USA Today yesterday decrying the nature of the Independent Payment Advisory Board. But the sad fact of the matter is, this is the Democratic alternative to the Republican plan to save Medicare into the next 50 years. That plan, the Democrats' plan, the President's plan, Independent Payment Advisory Board says 15 people are going to be picked. They will be paid well. They will then decide where are the cuts going to occur in Medicare. Now, true enough, Congress gets an opportunity. This 15-member board will come back to the United States Congress and say, here is the menu of cuts that we believe are necessary to have this year in order to keep Medicare solvent. By law, they have to come up with a certain dollar number of cuts. But as the President himself said in his speech to Georgetown here earlier this year, that's a floor, not a ceiling. If we need to save more money, we can go back to the Independent Payment Advisory Board and save more money. Now, Congress looks at the cuts that are brought to them by this unelected independent board and says, we don't like those cuts. Some of those cuts are going to be very damaging to poor seniors on Medicare. Do we have a choice? Yes. We can vote it up or down. If we vote it down, we have to come up with our own menu of cuts to then deliver to the Secretary of Health and Human Services. What if Congress can't agree? I know, when has that ever happened before? But what if we can't agree amongst ourselves? Do we get to do something like the doc fix that we do every year? No, we do not. That's the whole purpose of the Independent Payment Advisory Board. We cannot intervene on behalf of America's patients because the President's board has spoken. So Congress can't agree on what these cuts should be. So what do? We continue to fight. But guess what happens? April 15th of the next year, the Secretary of Health and Human Services, whoever he or she may be at that time, gets to institute those cuts that were brought to you by the Independent Payment Advisory Board. Now, is that a good idea? And I've heard discussion here on the floor today about $6,000. You know what? If you don't fix that sustainable growth rate formula, guess what's going to happen to every senior, rich and poor, who is on the Medicare program? Either they're not going to be able to find a doctor to care for them when they require care, or they're going to have to pay more money. How much money are they likely to pay? About $6,000 per senior. But look, the Independent Payment Advisory Board, something like that has never happened in this country. In a free society, we've got now an unelected board who is going to tell us what kind of medical care we can get, when we can get it, where we can get it, and most importantly, when you've had enough. And when they say you've had enough, that's it, no more. Dialysis, insulin, doesn't matter, you're full, you've had your share. That is the problem with the Independent Payment Advisory Board, and Congress then becomes powerless because frequently we do disagree with each other. If we can't come to a consensus, the Secretary makes that decision for us. And then the next year the process starts all over again. I've got a great deal of sympathy with my friends on the other side of the aisle because they did not include this language in their bill. And we all remember a year ago the very bad process that brought us the Patient Protection Affordable Care Act. And what was that process? It was the Senate on Christmas Eve that passed a House-passed bill that then came back over to the United States House, and will the House now agree with the Senate amendment to H.R. 3590? You all remember 3590? It was a housing bill when you passed it in the summer of 2009. It was a health care bill when it came back to the House. You did not include the Independent Payment Advisory Board in H.R. 3200 for a very good reason. The reason is it's un-American, and you know it, but now you're left to defend it.